And is there anything else that's happening at that time? Is any other limb shaking or anything like that?
Not that I've noticed.
OK, all right. And how's she fed at the moment? Is she bottle fed or
Bottle, yeah.
And she's taking all the bottle feeds?
Oh, yeah, she's a greedy moo.
And nappies are all OK? Is it both the eyes or the right eye?
It tends to be the right eye, but the left eye does it, but not very often. It's more the right one, and sometimes it's squint right in.
OK. And is there any family history of any eye problems?
I've got eye problems myself.
Any squints in the family?
Yeah, I had bad squints. I had surgery on them.
OK.
Yeah, she's just generally worried about it.
All right. So, let's have a look at Polly. If you pop her out and bring her onto the couch there, I'm just going to wash my hands before checking her. And no vomiting or anything like that?
No, nothing.
OK, so if you pop her up here. And no discharge from the eye?
No, none.
Hello. Hello, let's just have a shine a light in here. You're very cute, aren't you? We've got the eyelid on the right just seems a little bit lower compared to the left. And there might be a slight inturning of the right eye. Fine, and apart from that, she's absolutely fine in herself?
Yeah, yeah.
Fine, OK. Pop her up and let's have a look at her while she's sitting in your lap as well. That would be helpful.
Come on, love. Come.
Let's just have a look here. So what I'm going to do is get what's called an orthoptist or somebody at the eye hospital who specialises in checking children's eyes in a bit more detail.
Yeah.
Is that OK? The letter should come through fairly quickly.
Oh, good.
OK. So you've got her all day, have you?
Yeah, Mum's gone to work.
Right.
Gone back to work already.
Take care.
Thank you very much.
Bye-bye.
Thank you, bye-bye.
I gave birth less than 4 days ago.
Fair enough.
You're looking very well, I must say, considering I know what you've gone through. OK, so, any hyphens or anything in between Clementine Butler? No?
Just two separate surnames. One of them is Butler.
No.
What?
Two separate middle names.
Yes, what I meant.
Okay, it's not what you said.
Baby brain, we can allow
Yeah.
baby brain, yeah.
Hi there.
Hi.
OK. I wondered if you wouldn't be coming, because I saw that the little one had been off to hospital. Was
Yeah,
that
on
right?
Monday. Yeah, he was. Yeah, but I think
He's bounced
it was
back,
just
has he?
precautionary. Yeah, just in case he's little.
Yeah, OK, all right.
Yeah.
So you enjoying being a mum?
Yeah, I think it's quite challenging.
Yeah.
Just because I obviously don't really know what I'm doing, and I was saying to my husband yesterday, in the day I don't know if I should be doing more for him, because either he's eating, sleeping or crying, wanting to be fed. I don't know if there's anything I should be doing to stimulate him.
What more could you do?
Well, I don't know. There's times where I just think, OK, you're awake now, what should I be doing?
Just, I mean, interact and do as much. You just grasp those moments and do what you can, really. And then, yeah. I mean, the time will come when you've got a little bit more time. But so you went into hospital on Monday.
They just observed him and then they sent us home again. So.
OK. Has his breathing gone back to normal? It looks OK to me.
Yeah, he's definitely breathing a lot better.
Apart from having been in hospital, do you have any other concerns about him?
Only just about his head, actually.
Yeah?
We've noticed that his ear on one side is further forward than the other. We asked about it at the hospital on Monday and they just said it is because he is leaning on one side more than the other.
OK.
And he's flattened his head.
So they were relaxed about it and said it was...
Yeah, they had a good feel of his skull and said nothing seemed abnormal, but it said they said it was worth mentioning to you when I saw you.
OK.
So, yeah.
Right then, hello, mister. How are you? Who's mum?
I'm Mum.
Your mum, OK. Do you want to sit on mum's knee? And then, are you Nan? Yeah, OK. Presume so, but you couldn't get that so wrong. OK, right then. And so this is Jonathan. Hello, Jonathan. How old are you? 4. 4? Quite a big boy, aren't you?
Yeah.
That's good. OK, so he's eating and drinking right. He's been to nursery.
No, I didn't take him today.
Right, OK. Who's drawn the pretty pictures around it, okay?
See if we've got any bigger.
Right then, let's just turn you round a bit, mate.
Because he seems to be more appearing up.
Okay. Are they itchy?
No.
Are you scratching them? No, not at all. Oh, they look itchy. I want to scratch them.
Okay. It concerns me.
Yeah. They've all got a central punctum. They've got one there. There's one there.
Yeah, they've all
got it.
Yeah.
Yeah. Okay. All right. You don't know what it is. Anybody else got it?
No, just him.
Okay. New medicines or anything?
No.
Okay.
He's took his calpol.
Okay. I can't put a name on that. Okay. It may be bites. Children do come in and see us with rashes all the time. Most rashes are completely harmless and will just get better by themselves, in fact. And he's quite all right. Yeah. Playing. Okay. All right. Of course, every parent worries about the rash that can be caused by meningitis. Meningitis is a rare condition. Each GP would only see 1 or 2 cases in their career. Parents should worry if their child has a rash and the child is not very well. The rash of meningitis is red spots on the skin, and the important difference between meningitis and most other rashes is that the spots do not fade when you press on them. You can stick his top back on and just keep an eye on them, OK? Yeah. A well child is a well child. It'll probably just disappear by itself, OK? If it doesn't, or he gets worse, you bring him back. OK? Is that all right?
Yeah, that's fine. Thank you very much.
We won't put anything on. I'm surprised they're not itchy.
Yeah, that's what I said.
You know they don't itch. OK, bye-bye.
Is he smiling?
He'll smile just really randomly, it doesn't look like it's a result of something that we've done. He just seems to smile.
He's 6 weeks and 1 day, so it's a bit...
Yeah.
It's right on the borderline, isn't it?
Yeah.
You happy with his eyesight?
He's definitely tracking us when we move around, and he does look at things that are making noise, but not all of the time.
No.
Okay. So I wonder about his eyes.
Do you want to get him out of there?
Yeah.
And I'll have him up on the couch to examine him.
Oi.
So, you're absolutely right about the ears. One appears to be further forward than the other. And I'm sure the hospital is right. It's because of this asymmetry of the skull, OK? Which is a common thing. And I imagine that this is just going to settle itself down over the next 2, 3, 4 months, actually. We'll have him back and have another look at that.
Yeah, that'd be good.
It's extraordinarily uncommon that we need to do anything about this. So what we're doing here, this is obviously not a full eye check, but what I'm doing is just checking I can see down to the back of the retina.
Oh, it's okay.
You're a wriggly boy, aren't you?
Oh.
So, eyes are moving, they seem to be moving together.
Yeah.
Pupils are the same size, and there's a clear view down to the back, so we don't think there's anything like a congenital cataract that would be obstructing vision there.
Okay.
OK.
And you find your thumb again.
Hey, Ralphie. Hello.
Doing a fake crying now.
Yes, you are, aren't you? Let's just have a look at your spine. It's a nice mobile spine. OK, lovely. Dress him up. I'm just going to jot a couple of notes down while I remember them.
It's okay. There we go. It's all done.
He's a lovely boy, isn't he?
Yeah. And he's calm.
He's calm.
Yeah.
It's always nice when they're calm, isn't it? And listen, I should see him again, all right? Need to check that he's smiling properly, which almost certainly will go with following with his eyes as well. Those two things tend to go together. So if you can book an appointment for him to see me in 1 to 2 weeks.
Okay.
All right, Alfie? Time to go.
Your chair. Uh-oh, chair time. Let's see how we go. Thank you.
OK, you're all right.
Yeah,
Let me do
got
the
it.
jaw, because it's quite heavy.
Thank you very much. See you again.
So you book that appointment on the way out?
Yes, I will
OK,
do. Thank
cheers then.
you.
Bye-bye.
You ready to read it? OK, here we go.
Little fish. Much longer. I don't know, that's why I bought your book to read.
I'm Dr Graham. How can I help?
We've been on holiday for 2 weeks, and while we was away, she's complaining her ears were hurting.
Yeah.
I had an audiology appointment with her today.
Yeah.
So we went down there, and he said that her right ear is blocked.
Yeah.
And the left ear, it looks like something going on infection-wise.
Right.
And he says that I needed to come and see you.
And do they hurt both ears at the moment?
Which ear hurts, Robin?
That one?
Yeah, the right ear.
Does it hurt if I press here? Does it hurt at the back? The ear canal is quite red and there's a bit of pus in there.
Right, okay.
So she might have had an infection behind the eardrum that's burst.
Right.
And then left some
gunky
stuff in the canal. Should we look in the other one? For you to stand up, I think it'll be easier for me to get around it that way.
Okay.
And this one, if I press here, does that hurt? And that there? Nope, good. I would actually say that one looks pretty all right.
Okay.
She needs to have some antibiotics for that side because that's an infection.
That's the side where she's got mild hearing loss in?
That side?
Yeah.
Okay. Is she allergic to anything?
Not that I know of, no.
So we normally give amoxicillin, all right?
Okay, yeah.
So this is 1 spoonful 3 times a day for 5 days.
She should probably keep the ear dry.
Maybe for a couple of weeks till it's fully better. Is that all right?
Yeah, that's fine.
Good.
Who do I need to see about speech and language?
We could talk about it now if you want.
Yeah?
Yep.
She's very still learning to pronounce words.
Yeah.
So she can't say things like her brother's name is Jackson.
Yeah.
She says Jackson.
Yeah.
So her development in school is perfect.
Okay. Does the teacher have concerns
No, they
about
haven't
it
said.
at all?
No.
So it would be worth talking to them because
Okay.
there's a very wide range of normal, and a small problem like this, when everything else is fine,
Yeah.
will sometimes just improve with a bit of practice. But if the school is concerned and thinks that she might benefit from speech and language, then they might want to write a small report,
Right.
okay, to us. How does that sound?
Yeah, that's
Is that
fine.
all right? Because it
That's all
sounds like otherwise she's doing really well, and at her age it's all right to get quite a few things slightly wrong.
Yeah.
Is that okay? Good.
Right, say bye. Say thank you, Dr. Graham.
Bye.
Bye.